Hello. We'll stop off and get some Starbucks.
Good. I didn't eat. I was so busy I forgot to eat. And I'm like, I need more coffee.
I know just a very tidbit about midwifery, but I don't know.
Midwifery is fabulous. I love it.
I believe it. What led you to become a midwife?
With both of my daughters, I had midwives attend the births.
And what made you choose that?
Honestly, I had gone to an OB when I was pregnant with my first. We were visiting about my expectations, and she said, no, you need to see a midwife. You're speaking of the midwifery model of care. And I was like, okay. And so she wrote down the name, a midwifery practice, and I went, and it was fantastic.
Well, that's nice that they even did that rather than just saying, no, we're going to do things a little different. You know what I mean?
Right. And I grew up in a small community in Southeast Texas, and we had a local community midwife who would go out into the rural communities and deliver the babies. And
Southeast Texas.
Care. Whenever I was pregnant with both my daughters, I had the midwifery model of care. When I was in my early 20s, I worked at a hospital as a tech. I did ED, IMC, telemetry. I just got kind of burnt out. It seemed like it was just high intensity, high acuity.
It is.
I went to Johnson & Wales and got a degree in baking and pastry. So I'm a formally trained pastry chef and artisan chef. I had my first daughter and with midwives, which was amazing. And then we moved back home to Texas, and I was pregnant with my second daughter. I worked at a goat dairy as a cheesemaker, and that was great. I loved it.
Well, this may seem like a stupid question. Sorry to interrupt.
No, you're fine.
But what makes cheese artisan cheese?
Right. It was more
it's just fancy
slower.
cheese.
It's homemade cheese. And then we moved to Illinois, and my mom was diagnosed with terminal cancer. I was 30, and I was like, what am I doing with my life? I need to do something to make a difference. I want to make the world a better place. I want to use my life to make an impact. I want to leave it better for my girls.
The cheese making wasn't good enough for you or your girls?
I needed something bigger that created more ripples and planted more seeds with this life.
Going from making artisan cheese to a healthcare profession, especially like midwifery, is like, that's different sides of the spectrum. No one really sees who the artisan cheesemaker is, right? You're very involved with your clients when it comes to midwifery.
And I think there's a certain aspect of, like, midwifery is an ancient practice. Like, midwives have been around for centuries.
So cheesemaking though, right?
Right. And so if you look at it from the kind of person that can slow it down and take their time and respect the process, midwifery is the perfect calling for me.
Yeah, absolutely.
As a women's health practitioner, I really try to collaborate with my patients, work with them to do patient-centered care. That's one big point of the midwifery model of care, establishing trust, rapport, and then shared decision-making. A lot of women I've worked with had some sort of abuse, trauma, and so I'm very mindful to not be very unnecessarily invasive with them. So they'll come in with a yeast infection. I can tell they have a lot of anxiety about the traditional strip down from waist down, hop on the table, put your feet in stirrups, we'll do a spec exam. And when it's not necessary, they can go into the bathroom and self-collect a swab, and we can approach it that way. And also, I'm mindful of the shared decision making. I don't want to tell my patients what they need to do. I want us to work together on what works best for them, because it's really about meeting people where they're at, and it's not for me to tell them what must be done. It's a collaboration.
The powerful thing that I noticed you said earlier was meeting people where they're at.
Yes.
And that's something that was instilled for me, as I said, by my mom a long time ago, because everyone's life story is different. And I learned that very quickly in the ER. It was a kind of a shock to me how many different walks of life there are. You know, there are people that have beautiful mountain ocean views, living luxuriously around here. And then there's also grandma that they find down in the trailer park for 10 days and she's got bugs crawling all in her. You know what I mean? It's like one extreme to the other, but it's all within the same area. And so, like, you've got so many different varieties of care you need to give, but they should all be treated equal. They all need whatever care is going to get them back to baseline at least, or improve their quality of life. As far as midwifery goes, OBGYN, physician, they go through their medical school and then specialize in obstetrics, gynecology.
Yes, and they're surgeons.
When it comes to a midwife, what is the track? Is it a master's program? Is it a doctoral program?
So we're nurses. We're nurses first. Then we go for advanced education, and a lot of midwifery schools programs are going from master's to doctoral level. And so I'm currently the doctorate of nurse practice and the nurse midwifery track. So we are advanced practice clinicians.
It's the same thing with nurse practitioners all over the place. The shift has been towards no longer a master's, it's now a doctoral thing. thing. So
Yes.
you come out as a doctor, but it's not based on the medical model, it's based on the nursing model.
And even with midwifery, it's also the midwifery model of care. It's, the nursing model and then the midwifery model of care. And so I am an expert in women's health and pregnancy. And women's health for the whole lifespan. We see adolescence and puberty. We see just woman, childbearing year.
So it's not just the birthing process that you're there for.
Right.
So
we do
people
menopausal, perimenopausal women, entire lifespan.
Entire lifespan.
Entire lifespan.
And so do people just use midwives as their women's health? They do their annuals with them? They do their...
Absolutely. With my practice, what I do, woman care, so your PAPs, your breast exams, your annual checkups. We do STDs. We'll do the childbearing year, which is pregnancy into postpartum. We can establish care with the newborn up to 6 weeks and be the newborn's provider. Absolutely. We do family planning. That's contraception, birth control.
I feel like that's a huge thing that's missing from a lot of...
Yeah, we can do safe
families,
abortions. In the state of Washington, Attorney General did a reinterpretation of a law, and it says that APCs, nurse practitioners, PAs, and nurse midwives can provide aspiration abortion care. Traditionally, it's just been a medical service, medication abortion. Now we can actually do aspiration care.
That opens up a lot more options.
Yes,
because
there's a lack of services.
Lack of services, and then also,
high wait times.
High wait times, and then also, I always try and think about, the financial burdens of healthcare because they are very, very huge.
Yes, well, we're in a sick care system, not a well care system,
exactly.
And in sick care, it's profitable.
Unfortunately, but the as far as utilizing a midwife, I mean, it sounds like there's a plethora of reasons why it's a great idea. As far as the financials go, is it more expensive than seeing OBGYN, less expensive than seeing OBGYN?
We're advanced practice clinicians. We're more cost effective. We have amazing outcomes. If you look at any evidence, midwifery is based in evidence, right? We're educated, and so it's evidence-based practice rolled into clinical settings. We have amazing outcomes in birth. We have amazing outcomes when we're involved. It decreases primary C-section rates. We are completely competent and actually desired to provide abortion care because it's the continuity of care. A lot of the people that see us, when they want an abortion, they don't want to go outside and see someone else. They'd like us to provide the service for them.
Gotcha. So they've been getting all the services for you thus far, and then all of a sudden, had that not been in effect, they'd want to get an abortion and they would have to do it elsewhere. But
with
now
someone they don't have established rapport and trust with.
Exactly, and that's such a sensitive thing. You've been getting care continuously from someone. Oh, you could always go on someone's recommendation, but it's still not the same. And so being able to offer that, I think, is amazing.
It's huge. Also, when I say women, it's a very inclusive model of all women. So we work with women, we work with transgender women, we work with men with uteruses. We see everybody. We also support and serve the transgender community and can do gender affirming care and also hormone therapy.
And with gender affirming care, explain that.
It's supporting people where they are in their gender continuum. So if I have a transgender woman come to me, I will do breast exams on her and we will discuss her hormones. If I have a man who has a uterus come to me for pregnancy, we will use proper pronouns, and he is a man who has a uterus who's delivering the baby in his partnership. With the hormone therapy, that is advanced education. Same with abortions.
Yeah, absolutely. This isn't the traditional type of way things have been done. There's a lot of things that are kind of, brand new kind of developments. And so
as midwives, we are in a prime position to serve people who are marginalized, face a lot of disparities.
Yeah.
We're very capable and supportive in that.
Well, that's refreshing to hear.